This video is about macromolecules and their uses. Here are just a few examples of macromolecules that are used in everyday life that you may not have even thought about before. We are going to start off with a relatively simple diagram of the knee. These are some important components of the knee that you will need to know for the upcoming video. Knee replacement is one of the most carried out surgeries in the UK. There are many reasons why you would need a total knee replacement, and the most pressing condition is arthritis. There is no cure for arthritis, and it can cause debilitating pain. Most forms of arthritis occur from natural wear and tear. However, some forms can be caused by autoimmune disease, and the aim of a total knee replacement is to resurface parts of the knee to relieve this pain. The knee replacement consists of three main parts: the femoral component, the plastic spacer, and the metal plate. This is a simplified walkthrough of the process of the surgery. First, the surgeon cuts open the knee and cuts away the damaged parts of the bone on the inside of the knee. The metal plates are then fitted with a plastic spacer in between. The wound is then closed with sutures and the wound is covered with a dressing. The patient is then placed into recovery and monitored, and hopefully after a number of weeks the patient can return to normal daily activities with eventually less pain than before. A surgeon and other healthcare professionals in the operation room need to prevent disease by wearing gloves. There are three main types of gloves that can be used. These are vinyl, latex, or nitrile gloves. Latex gloves are made from naturally occurring rubber latex that comes from trees. Latex is a milky fluid found from the bark of rubber trees. Some people's immune system reacts to latex as a harmful substance and triggers antibodies to be released as a response. Latex is actually preferred by surgeons as they are more versatile. However, to prevent this allergic reaction, PVC or nitrile gloves are chosen. Polyvinyl chloride is a polymer made from chloroethene and is chosen because of its ability to be durable and flexible. Polyvinyl chloride, or often known as PVC, is made by an addition polymerization reaction of chloroethene. This reaction opens the double bonds in the vinyl chloride monomer, allowing neighbouring molecules to join together. PVC is made by radical polymerization in suspension. During polymerization, the PVC precipitates out as it is insoluble in the monomer. The chloroethene is made from chlorine and ethene, that are both very accessible reagents. Ethene is obtained from petroleum and natural gas, and chlorine is extracted from sea salt via electrolysis. The step-by-step process is displayed in the video. Once chloroethene is produced, it is treated with peracid and pressure to obtain polyvinyl chloride. There are multiple types of prosthetic you can have. Metal and plastic is the most common type of implant. It features a metal femoral component that's placed on top of a polyethylene plastic spacer attached to the tibial component. The metals commonly used include cobalt, chromium, titanium, and nickel. Polyethylene is produced by addition polymerization via a chain growth mechanism from ethene with a catalyst. Highly cross-linked polyethylene is based on low-density polyethylene, which is produced by free radical polymerizations with high temperatures and pressures. However, research has identified that multiple initiators can be used as long as they prove to be soluble in supercritical carbon dioxide, which is used as a solvent. Changing the reaction time, temperature, and pressure enables a broad degree of physical properties which make polyethylene so useful. This is a diagram of a microscope that shows the difference between highly cross-linked polyethylene with polyethylene. This is the most inexpensive implant and has the longest record for safety and implant life span. It also increases replacement longevity and wear resistance more than other implants. However, a potential risk is an immune reaction triggered by tiny particles that wear away from the spacer. This can cause the bone to break down, leading to loosening and failure of the implant. There is a lot of research going into this, and highly cross-linked polyethylene has been proposed. However, there still are concerns about using this material. Highly cross-linked polyethylene is formed when ultra-high molecular weight polyethylene is irradiated by gamma or electron beams. The irradiation produces free radicals which, in the presence of oxygen, break the carbon-hydrogen bonds and help to form crosslinks. An increase in radiation dose increases the number of crosslinks formed. To close the wound, sutures are often used under the skin to reduce the surface scarring. There are lots of dissolvable sutures, but polydioxanone is usually chosen for knee replacement. Polydioxanone has reduced initial tensile strength when compared with other materials. However, it retains 70% of its original tensile strength at 2 weeks, 50% at 4 weeks, and 25% at 6 weeks, as it reabsorbs slower than others. This makes sure that it has a high retention of strength, which is helpful in knee replacement surgery. Polydioxanone is a dissolvable suture, so it is degraded by hydrolysis in the body, and the products are excreted in the urine, eliminated in digestion, or exhaled as CO2. The synthesis of polydioxanone is relatively easy as it is synthesized by polymerizing purified paradioxanone. However, it does require a low pressure, a certain temperature, and the presence of a catalyst. This is a ring opening polymerization forming a polyester. Dressings are needed to decrease the risk of infection and help the wound to heal nicely. Mepiplex is a brand of dressing that is commonly chosen due to its self-adherent 5-layer silicone border dressing. Polyurethanes are produced by reacting diisocyanates with polyols with a catalyst or UV radiation. This reaction produces a polyester that creates a hydrophilic foam that is capable of absorbing more than its own weight. This is good for a dressing as it can keep the wound dry to reduce infection and prevent the wound from reopening. Some complex dressings also have alginates that have proven to have antibacterial, antifungal, and antiviral effects. Alginates and their derivatives have also been reported to have anti-inflammatory and regenerative effects. After the hard bit is done, the patient is placed in a hospital bed on a ward to wake up after the surgery and to start the recovery process. They will be monitored for a couple of days in hospital and administered pain relief as the knee is likely to be very sore. After this, they can be sent home to recover. However, it normally takes up to 12 weeks to fully recover from the surgery. The patient should have better movement than before the surgery, but shouldn't be able to do anything that they couldn't do before the onset of arthritis. The patient may feel a bit like Bambi on ice to begin with, learning to walk again. Thank you for watching my video, and I hope that you learned something about macromolecules.